So what is the development of the GARFIELD study in terms of coupling with economic data?
So, as you know, we've been undertaking this large prospective registry in 35 countries around the world over the past 9 years. And during that period of time, from the outset, we decided to do two things: to collect clinical data prospectively as we follow patients presenting with newly diagnosed atrial fibrillation, and also collect information that allows us to make some assessment of the health economic impact and burden of atrial fibrillation. And what we're starting to see is that there is an important both clinical burden and economic burden associated with atrial fibrillation, and that varies from country to country and from health system to health system, dependent upon important factors: how much utilization of healthcare resources there in the outpatient setting, in the inpatient setting, how do complications of atrial fibrillation impact on the overall cost burden for patients. And as we have long-term follow-up now, we hope to be able to bring those two data sets together and start understanding what both we can achieve clinically and the value that brings to the health economy more broadly.
And what is your opinion? What value will the governments retain on this data?
As we know, around the world, governments collect a lot of data to make their health systems and their health economies more efficient. We hope that this prospective data set will add to that because we have looked very carefully at characterizing patients and very carefully at the clinical outcomes. This, combined with all the other data available from many different studies, I think will start to help us understand how should we organize the delivery of care most effectively and efficiently so that we can achieve both the best outcomes for our patients and the most careful and appropriate utilization of healthcare resource.
What is the quota, the part of the Italian patients and clinicians in this register?
Italy has made a very important contribution to the GARFIELD AF registry. 2,209 patients were included. The overall registry has 52,000 true prospective patients and an additional 5,000 retrospective, followed prospective patients. So as you can see, a very important contribution from Italy. I believe that that sample size will allow for some important analysis in the Italian-only context by the leaders of our study in Italy.
We hope very much. And will these results be published somewhere soon?
Well, we've had many publications from the GARFIELD registry globally, and now at a national level as we complete 5 cohorts of recruitment and minimum follow-up, so those data will start to be published by national leaders in each country.